right, guys. I hope you had a nice little break, but we want to keep you involved and engaged. So we're going to ask a couple of questions and give you the opportunity for a little bit of movement. So, since we're going to talk about healthcare and healthcare innovation, I'm going to ask you a series of questions. And if this question applies to you, you can stand up. Okay? So, if you have accessed healthcare in a clinic, in a drugstore, or in a grocery store, stand up. Okay, quite a few. Have you, if you're not yet standing, had a telehealth visit since post-COVID? Stand up, a few more. Okay. Have you sought general medical advice online or through an app? Stand up. Okay. If you have had a joint replacement or have an immediate family member who has had a joint replacement, please stand up. If you're able, I should say. Exactly. All right. Okay, and then the final question is, if you have asked ChatGPT for medical advice, please stand up. No, okay, everybody can sit down now. Thank you for participating. All right, so I am so glad to be with this important panel to talk about healthcare and innovation in healthcare, both around access, around how healthcare is delivered. So I'd like to introduce our panel, starting with Scott Centorino, who is the Executive Director of the Health Reformers Academy. For those of you who want to get a master's clear class in healthcare, I encourage you to listen to Scott and what's available there. He's also the Deputy Policy Director at the Foundation for Government Accountability. Dr. Robert Sinnott is with us. He has over 25 years of experience in life sciences, chemistry, biotechnology, and nutrition, and he currently serves as the Chief Scientific Officer at USANA Health Services. Dr. Peter Chang is joining us from Tampa General Hospital, where he is the Senior Vice President and Chief Transformation Officer. He's responsible for designing forward-looking healthcare strategies to improve clinical quality, efficiency, and care coordination while addressing and decreasing the total cost of care. So I'm going to start with Scott. So Scott, we know that in the U.S., our ratings around science and technology and innovation are really great. We're first among countries, but when we get to healthcare quality, we're 10th. When we get to the fiscal sustainability around healthcare, we're 29th. So what are we overlooking in the healthcare sector? Can you talk about that?
Absolutely. Thank you so much for the question. Thank you all for having me. What a terrific event this is. It's a real honor. It's a huge question, obviously. I would point out two contradictions that we're overlooking that kind of undergird a lot of the problems in healthcare that you're seeing today. The first is, if you look at our healthcare system, as you said, the quality of the healthcare we receive is pretty good. The actual time you spend with your doctor or nurse behind the door once you go into a facility, it tends to be pretty good, maybe never better. It's the payment system, the way we pay for these services, this care, that's really fundamentally broken. And the contradictions are these. So first, our whole payment system is driven by these massive government programs right now, Medicare, Medicaid, and if you don't believe me, just read the federal code. I know I've got a couple doctors with me. You're stuck with a lawyer talking first. Read the federal code, and almost all or a lot of the healthcare laws that are out there are written like this. If a provider accepts Medicare, they must do X or Y. That's how a lot of law in this country is done in the healthcare space, because almost every provider has to accept Medicare and does accept Medicare as payment. So because of the distortions that come from the government dominance of the payment systems, we have a lot of the mandates, the bureaucracy in our payment structures that we associate with sort of a single-payer, government-dominated system. But we don't have maybe the one, at least in a political sense, the one benefit of that kind of a system, which is you ask the average person, and they're still worried about a catastrophic event. If they get T-boned at an intersection through no fault of their own, will they be covered? People are still worried about that kind of backstop. And a big reason for that is we, even in the private market, private insurance market, I should say, we really shouldn't call it insurance. I think of it as more of a payment system because, almost everybody in this room probably has car insurance or homeowner's insurance. Imagine using your car insurance every time you went to the pump to fill up your tank or got an oil change. Imagine using your homeowner's insurance every time you got a dishwasher or called a plumber or called a locksmith. That's how we use health insurance. It's not really insurance in the traditional sense. It's a payment system. It's a middleman payment system, and it serves some important functions for that reason. But it's not quite what we think of as a free market, even in the freer parts of this system. So those are the two contradictions that I would point out. And you mentioned Health Reformers Academy. I would just say that, a couple of years ago, Josh Archambault, a former colleague of mine at FGA, and then a colleague of his, Scott Darnell, he worked for Governor Romney. Scott Darnell worked for Governor Martinez in New Mexico. They recognized what I also recognized. They were quicker to recognize it than I am, which is there's just a dearth of center-right healthcare experts out there, especially in the rooms that really matter in Washington and state capitals. And so that's why Health Reformers Academy was founded, to serve people in those rooms and in rooms like this one, to get people outside of that system to get smarter on healthcare, who are passionate about healthcare, get up to speed. And I can talk more about that later, but just wanted to point that out.
Thank you. So let's talk, Dr. Sinnott, a little bit about our health and our potential for longevity, and what is changing, what are the innovations in that area, and what might we not know about yet?
Yeah, so those are great questions. So longevity is something that's been a focus for me for decades. And honestly, it's not really longevity so much as it is what's called WellSpan, because longevity has a lot of variables that we really can't control. Your genetics is really not under your control. Although knowing your genetics, and there's a lot of nutrigenomics and nutrigenetic stuff that's coming out right now that will help you understand your personal genetics, and I think that's going to be a revolution in healthcare too, because if you know that you have a propensity for a certain genetic trait, you can do things to de-risk that. You can make lifestyle changes. You can make eating habit changes that will de-risk that genetic profile. But anyway, so we focus on, the reason I love focusing on prevention and longevity is because it's both practical and affordable and sustainable. I've worked in pharmaceuticals for a decade before I went into nutrition. And pharmaceuticals are very interesting. I love the science behind it. We've got some amazing research going on in the United States. We're #1 in the world as far as innovation and scientific research. But the thing is that a lot of those innovations turn out to be so expensive that they're out of the reach of most people. And so that's another big issue that we're having to deal with is health inequality in the United States. There's different ranges of care. Some of the things that I've been most interested in is incorporating ideas, like innovative ideas, into healthcare. And particularly, I've been drawing on ideas from what's called blue zone research. And if you've never heard of blue zones are areas of the world where people just naturally have much higher lifespans than in other parts of the world. And when they do research, a lot of it has to do with the way their social circles are formed, the foods that they eat indigenously, and then also the exercise that they get, the physical activity that they get. So I love researching the blue zone research and trying to find ways of implementing that into human healthcare. Another area that I find very exciting, and my friends here are going to tell you a little bit more about that, is biometrics. The biometric devices that are coming out right now. I think are just so amazing, because I think that's going to revolutionize healthcare. We're on the verge of having a physician on your arm 24/7, 365, and then combined with AI and combined with telemedicine. This is something that is really, I believe, going to really impact people's wealth span. So I don't know if lifespans in general are going to go up, because I think, you know, there is a finite amount on lifespan. But it would be great if, you know, if you have 100 years in your life, that you have 100 healthy years and not 80 healthy years and 20 years of just suffering. You know, I think if we can impact that number, it would make the world a very different place. So thanks for the question.
Thank you. Dr. Chang, you have a great title, Chief Transformation Officer at an important hospital here in Florida. We know that Florida has a lot of citizens who are aging, and the baby boomers are coming, and we're aging as well. So tell us what's happening in the delivery of healthcare in the hospital setting, and what's happening at your hospital.
Great. Thanks for the question. So I'm originally from the islands, but grew up here in Florida, so I consider myself a Floridian. And I was actually in front of a Senate healthcare panel on Tuesday talking about access and changing the paradigm about how care is delivered. And an interesting statistic came out during that panel that 1,000 people move to the state of Florida every single day. And if you add that up over the year, it's probably close to 350,000 total people, which is about the size of the city limits inside of Orlando and their population. But those people, those citizens, aren't bringing their hospitals or their healthcare providers with them. And so we have to look at things from multiple lenses. The first is the healthcare provider shortage, right? Through the pandemic, we've seen mass shifts of talented, skilled individuals leave healthcare to pursue other endeavors. And in the sense of seeing this aging population rise, in addition to general population rise in the state, we really have a challenge in front of us. Building more hospitals, although we need more hospitals, it could be an answer, but at well over $1 million per bed to construct a hospital, it's not financially feasible to do so. So some of the innovative ideas that we're working on at Tampa General, and it really is thanks to the foresight of the government. You know, it's funny that I can say that, but at the onset of the pandemic, right, we saw what was going on in New York and Wuhan, and CMS opened up the availability for hospitals with a Medicare license to provide hospital-based care at home. So this is not home health, this is not ambulatory care. This is taking a patient that should be within the walls of the hospital receiving inpatient acute care services and taking them to their home and delivering that care. So right now, it's funny, earlier today I was doing the Great American Teach-In at my 9 and 12-year-olds class, and actually wore the sensor that we send patients home with and had my vitals up on the screen, and we're teaching the students about blood pressures and heart rates. And we monitor our patients 24/7. We'll identify them in the emergency department or somebody who already has a stay at the hospital, and we'll, of course, identify for safety first. That's the number one thing. We monitor them 24/7, take them home, and bring doctors, nurses, equipment, and services to their home to complete the rest of their hospitalization. To date, we've seen well over 200 patients. I think the statistic I'm most proud of is when you look at the readmission rate. For general Medicare patients, it's around 18 to 20%, looking at that specific diagnosis group. If we look at that same group in our hospital home patient population, our readmission rate is 3.6%. So looking at why is that, right? When we're in the home, I show you how to arrange your pill box day one, but day two, it's test time, and now it's your turn as a patient. So we sit there and we teach them how to take care of themselves, how to access and coordinate their care, and that's one of the reasons why readmissions is so low. So initially, this waiver was attached to the public health emergency, which expired earlier this year, but luckily, with the wisdom in Washington, they extended it through 2024. So we have another year and a month and a half to really prove our outcomes. So we're rapidly growing. We actually created an entity within our program to help other hospital systems stand up hospital at home programs, because we really do believe that it is changing the paradigm of how care is delivered.
And in terms of affordability and the hospital at home program, talk about that for a minute.
Sure. So I think the jury's still out on affordability. When you first start a program like this, it takes a lot of effort to make sure that the standard of care and safety is top notch. And so in looking at that, the costs are going to be relatively high, just as if you had a startup business, right? You can't expect to grow your revenue rapidly. There's lots of investment that needs to occur. That's what's occurring right now. But with that said, most of the studies are showing either an equivalent cost or a 10 to 15% reduction in what it takes to take care of a patient on the inpatient side. But we're not looking at the secondary benefits of readmissions, which is a huge cost, in addition to, I think what the most important piece of this is really the patient experience. If you take an 85-year-old with pneumonia, put them in a hospital bed, you're bringing everything to them. They're not getting out of the bed except to go to the bathroom, if that, or there's a bedside commode that they're using. Versus at home, even if they are sick, they have to challenge themselves a little bit. Get up, brush your teeth, go make a cup of coffee, right? Call us if you need help, those sorts of things. And just that component of the mental well-being of our patients, I think makes them actually heal faster, which is the most important. We have actually a board up in our office with pet selfies that we take with the pets of our patients, just so we can catalog that. There's no HIPAA violations for pets. So we have our picture wall, and we're part of the family, and it just reinforces the importance of even something like a pet and the impact it has on our patients' health.
Great, thank you. Okay, our time is flying, so I want to do a bit of a lightning round where we talk about what would you like this audience to take away, what would benefit them as members of the policy circle and participants here today. Scott.
Sure. So I have the privilege of trying to convince you all that the world of healthcare is worth getting invested in. Health Reformers Academy is looking for, I think, a lot of the people in this room to join us. This world is fun. There are a million ideas out there. If you're interested in center-right policy, but there aren't that many people on the ground filling these important positions, both inside and outside of government, that care about this. The typical experience for me, Doctor mentioned testifying in the Florida Senate. I don't know what the group with him was like, but when I go to testify in a state capitol especially, usually it's me and then 40 people on the other side of the issue lining up to testify on the other side. It's a very lonely world out there. If you talk to the average person who's actually working on the details of a bill in a state or the federal capitol, it's usually a 27-year-old who got into this position on the right who was interested in tax policy or defense policy, but somebody has to cover healthcare in that office, and so they gave it to him. And he doesn't know anything about it. He relies on outside experts, and there are about 5 of us ready to help him. It's the opposite on the left. Obviously, a lot of people on the left end up going into those positions because they care about healthcare. And so there's a little bit, there's a huge opportunity for people in this space that are interested in making an impact. The realm of healthcare is ripe for this. I would say, this will be the last thing I say, is I think this is maybe me showing how optimistic I am at heart. What makes me optimistic is how pessimistic I am, because we're kind of at a breaking point in the next few years. I mean, the Medicare Trust Fund is going to be insolvent by 2031. Medicaid is already the single largest line item in every single state budget and growing. 40% of all Medicaid enrollees are able-bodied now. This is going to hit a breaking point just on the numbers, on the math. I was told there would be no math here, but I'm pretty sure that the numbers will create a problem in the next few years. That means opportunity. It also could mean disaster, but it means opportunity for people that want to see reform. And ultimately, reform requires reformers. And if you're in this room, I have a feeling you're interested in this potentially. Please, please, please consider looking up Health Reformers Academy. Please look at the work that my other organization, Foundation for Government Accountability, has done in this space. We are working on healthcare, but like I said, it's a lonely world out there. We'd love to have you join us.
Thank you. Dr. Sennett, you got us on this long and healthy well span for life. What would you like this group to take away from your comments and your focus area on longevity and innovation?
Yeah. So 2 takeaways from this is, number one, that most of the people in this room are much younger than me, and you've just got to realize that your health is still within your control. Okay, so that's something that I'm really encouraged that the younger generations. I'm watching my 3 sons who are now in college. they actually are that generation is actually paying attention to their health. They pay attention to what they eat. They make sure they get the right activities. They're concerned about mental health. They understand mental health way better than what we did during our generation. They understand genetics a lot better. And they're also using the devices, to monitor their health. And, when they notice a problem, they're getting healthcare interventions early and things. So I'm very positive for the innovations that, that we've been talking about. I'm very positive on the future of healthcare. I think like you said, we're going through a very, very difficult time right now where something's got to give. But I'm very confident that the technology that's coming our way is cost-effective, sustainable, and will actually, in the long term, increase access to healthcare and reduce the cost of healthcare. So I'm optimistic I'm bullish on healthcare in the future.
Thank you. Dr. Chang, you're leading an important innovation that we're hearing about today in terms of having the hospital at your home, but what other innovations you want us to know about and look forward to seeing come in our well spans?
Sure. So I always start off with the definition of insanity is doing the same thing over and over and expecting a different result. And I think that is exemplified in medicine to the nth degree. And so if there's one thing I would like you to take home from today is that providers like Tampa General are actively pushing to change the way healthcare is delivered. Inside you don't have to raise your hand, but who thinks healthcare is easy to consume? We always want to talk about our patients from the lens of a consumer. Remember when the internet first came out, you would search for the item you wanted. You would go to the retailer that had the highest quality before Amazon, right? If there was such a thing. And you would buy based off the quality of the product and the reputability of the reseller, and you would make the purchase and price, right? But we're not there in healthcare. We're approaching that. So really that shift from consumer or patient to consumer is going to take us a while. We're still patients. We don't control costs. We don't really have a good insight into what the healthcare quality is, and access is a huge issue. So is equity. That's another whole panel by itself. And so some of the other things we're really looking to innovate on are the concept of changing our call center into experience center. Really navigating care you call in or you have a digital touch via web or chat, we're able to catch you and navigate you to the right care in a timely manner at your convenience, right? There's a really great book out there that says the patient may see you now, which is a really good read because we need to shift that paradigm on having healthcare so provider-centric, like you got to work around my schedule because I'm the healthcare provider. No, we really need to start to focus in on our patients.
Well, these are all really important things for us to consider. Please join me in thanking our panel on healthcare innovation.